Hi, this is Pet Dentist Joe Banyard, and I'm going to talk to you about root canals in this video. First of all, I should just warn you, these are very difficult procedures and they take a lot of training to learn how to do correctly. Veterinary dental specialists offer these services to pets and they have a high success rate. Okay, look at this tooth. What do you see? Do you see that black spot? That is the pulp, and it's open to all the bacteria in the mouth of this dog. Look at this x-ray. Compare the two teeth. These are the left and right lower canine teeth. The green area shows you where the pulp cavity is, and the white area around the pulp is the dentin. At the bottom of the cavity, at the very tip of the pulp cavity, that's the root apex. Okay, the root apex is the bottom tip of the tooth, deep in the bone, and is where the blood supply gets into the pulp through tiny tubules. Look at the bone around the apex of both teeth. Do you see that it's a bit blacker on the right side than on the left? That shows that there's bone loss on the right side, and it's because of infection. The infection comes from the mouth, goes down the pulp cavity, reaches the apex, and then goes through the tubules into the bone and creates an abscess there. When veterinary dental specialists perform root canals, we're taking a beginning x-ray and we study the canal of that dog's tooth. This is the pulp cavity. Different dogs, different teeth, different ages, different species have different canal shapes, and we need to know the shape before we get into doing the root canal. Also, in the canine tooth of a large breed dog, these canals can be 45 millimeters or more, and some teeth have 3 roots, and if the crown is broken, they all need to be filled properly. The first thing we need to do is get into the canal, and we decide how to do this based on the x-ray. Our prime objective is to get all the infected material out of the pulp cavity. The canal is shaped using special tiny files and also sterilized as much as possible. It is then sealed with a sealant and filled with a special rubber called gutta perca, and the opening of the canal is filled with a hard plastic that sticks to the walls of the canal, preventing infection from the mouth getting into the pulp cavity. All through the process we have to take x-rays to make sure every step is done correctly, and this is what the final x-ray looks like for a one-rooted tooth. The canal is sealed with the materials to prevent infection from getting into the pulp and into the bone from the mouth. This is what the tooth looks like in the mouth. Remember, you cannot tell what the root canal treatment looks like just looking at the crown of the tooth. To make sure the root canal treatment is successful, the tooth needs to be x-rayed in 6 to 12 months after the treatment and every year for 5 years. Thanks for watching.